16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Nothing you wear is more important than your smile. A very pleasant evening to all viewers. This is Marina Francis. Welcome to this episode of BMC Global Live Al Hilal Health World. Nothing but lifestyle. We know that smile is one of the best tools to boost our confidence. And for a confident smile, we do require confidence in our teeth. We are aware of certain dental procedures that will help boost the confidence on our teeth. Let us know in detail about them. So in this episode, we are going to talk about intraoral scanning and about aligners as well. To talk to us in this episode, we have with us Dr. Rajesh Radhakrishnan. He is an orthodontist with over 18 years of experience. He has an expertise in braces and Invisalign. He is currently available across all branches of Al Hilal Hospital and Medical Center. So let us begin with today's discussion. Very good evening, Doctor. Thank you for joining with us again.
Good evening. Thank you so much for this chance for talking to you.
Yes, Doctor.
Yes.
Doctor, today's topic we have taken intraoral scanning.
Yeah.
So what is exactly intraoral scanning? How does it work?
So intraoral scanning is a new version of how we can take impressions of the teeth. Okay. So before, what we used to do is we used to take a mold of the teeth with a paste which hardens in like 5 minutes, and then you get the exact shape of the tooth and all the stuff. So the thing is, when you use that, there are certain patients who have difficulty with it because they, what we call as gagging reflex. So they tend to have a gagging reflex which may make them to vomit sometimes, and so these issues are usually faced. Now with intraoral scanning, it's just like how you take a picture of your teeth. The scanner takes the complete picture of your upper and lower teeth, and it shows you exactly how your teeth is and how they are positioned. So it gives you a better picture of how your teeth is, and it is much better way of taking records, intraoral records for your any procedure, not only for LNS, even if it's for crowns, even if it's for implants, all this, you get a much better accuracy and better picture of the tooth as it is. So that's why intraoral scanning is a little more better than your previous procedures like taking impressions and all the stuff.
Okay. So, doctor, what is the purpose of doing intraoral scanning? After doing intraoral scanning, what is it used for?
See, intraoral scanning, like I said, it's actually a tool which is used for making records. So now, if you come in for braces or if you come in for aligners, we have to take certain records like photographs, X-rays, and then the impressions of the tooth. Now, X-rays and photographs we have that separate. So impressions of the teeth we usually use like what we call as an alginate impression, which is like powder mixed with water, and you take the measurement with that, which hardens in 5 seconds to 10 seconds. And the other way of doing it is with intraoral scanning. So you're getting all the records which are highly accurate when compared to your impressions. So you will be able to make all the records which is required, and you can use it for further reference, and this helps to design the treatment what is required. It's not only for LNS, like I said, it's not only for LNS, even for crowns, bridges, dental implants. For most of the treatment, you can use it as a tool where you can plan your treatment. So it is helpful in planning your treatment for the future.
Okay. What would be the advantages of using intraoral scanning for the patient? How is it beneficial for the patient?
Okay, now for the patient, the first thing is convenience. That is, we are not putting a paste into the mouth and removing it, and it's gooey and all the stuff. That is not there. So the patient will be much more comfortable, no gagging reflex, and you get more than, say, you can say more than 99% accuracy with the intraoral scanning. So your treatment results will be perfect, exactly how you want it to be, and you don't need to repeat the impressions again. With the intraoral scanning, you can see if you don't like the scan, you can delete that and you can take the scanning again to get the proper records. So it's all about convenience, accuracy, and comfortability of the patient. So it is much more better than just taking impressions.
So, doctor, after doing intraoral scanning, can we see the results or how the teeth would look after the treatment? Is it possible to see that?
Yes, of course. We will be able to get all the simulations what is done. So once we do the scanning, of how the teeth at the present moment it is, and then we have something called as a treatment simulation or smile makeover. In that simulation, we can actually show you how your treatment will be even before you start the treatment. So suppose a patient has a lot of crowding, that his teeth is not positioned properly. Some teeth are positioned forward, some are back, and you need to, we call them align the teeth. So if you want to align the teeth and you want to see how it looks like at the end of the treatment, that we can do it by a simulation and show you exactly how the treatment will be how the teeth will be at the end of the treatment, even before you start the treatment. So you get a visual picture of how the teeth will look like. So you will be able to understand what we are trying to do. So this advantage is there when you do intraoral scanning. So we will be able to show you an approximate possible treatment result at the end of the treatment. So that gives us a better picture of how the teeth will be aligned at the end of the treatment.
Okay, so it gives a clear idea, or
yes,
it
exactly.
gives a picture to the patient.
Yeah, because most of the patients come and ask us, is it possible to see how my teeth will look like if I start the treatment. So until now we didn't have much options with it, but with intraoral scanning we will be able to show you an approximate treatment result. Why I say approximate is because when you do the treatment planning, it can be much better than the simulation what you see.
Yes.
So it's that's why I say it's an approximate treatment result.
Okay. This intraoral scanning, how accurate does it show the teeth? How accurate is it?
See, this is actually, I would say, around 99% accuracy when you do the intraoral scanning, and the treatment result is almost 99% accurate.
Okay.
So what you see in the simulation is, like I said, it's accurate, but we can make it much better with the treatment planning. So what you see is what you get when you do aligners. So when we plan the treatment, we see how your facial structure is, how the teeth are positioned, what are the limitations of bone, within the bone, how much we can move the teeth. All that we can plan with the simulation, with the x-rays and the photographs what we have. So with that we can plan a proper result, and the result what you see in the treatment plan is actually the 100% result what you get at the end of the treatment.
Okay. Doctor, does the patient feel any difficulties or any side effects as such while doing the intraoral scanning?
No, as such there's no side effects with intraoral scanning. It's just like taking a picture.
Okay.
So you're just trying to take the picture of the tooth, and that is which is visualized on the screen. So in this case we have a laptop with which we can visualize the tooth on the screen, and like they say, seeing is believing. So when you see how your teeth is, it makes you believe that how your teeth and what we are trying to do.
Yes.
And the simulation as a part of the part where you tend to understand how the teeth is moving and what are we trying to do with the teeth to give you a better smile.
Yes.
So that gives you a better perspective of your treatment, of what you're going to do and where you end up at the end of the treatment.
Doctor, what would be the approximate cost in Bahrain for doing this treatment, for doing the intraoral scanning?
See, at the moment we are not charging anything extra for the intraoral scanning. We have an offer going on all the branches in Hilal Hospital and Medical Center, wherein we can scan and show you, intraoral scan and show you how your treatment result will be. It's only when you go in for aligners that you will have to see how the cost factor works out. But at the moment we are running a campaign all across Al Hilal Hospital and Medical Center, which we start from 1,500 BD, and that can be paid in installments.
Okay, so that's beneficial for the viewers.
Yes, because I do understand that it's a huge amount, but we can make it in installments. The huge amount is basically because of the lab charges what we are incurring. So we are trying to minimize the lab charge and trying to our best to accommodate from our side for the benefit of the patients.
Yes, definitely we want to know more about aligners as well.
Yeah.
Viewers, stay tuned. We will be back after a short break.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Welcome back. You're watching BMC Global Live Al Hilal Health World. Today we have with us Dr. Rajesh. Most of you viewers would have already seen an earlier episode with Dr. Rajesh regarding aligners. So as a continuation to that episode, I would like to know more about such orthodontic treatment. So doctor, regarding aligners, what is the difference between aligners and braces?
Good question. Now, aligners are, you can say, removable kind of braces. Okay. And braces as such is fixed. Mm-hmm. That is, you have, when you do braces, you have brackets being placed on each teeth and you have a wire running across them, and that is fastened with a rubber module, what we call. So that helps to make the teeth movements faster. And that's how the teeth moves usually. Now with aligners, it's a removable kind of braces. So it's not just one aligner what you'll have. Depending on each patient's situation and the presenting problem what they have, what we call as malocclusion. So depending on that, we plan the treatment. That's why I said we do a treatment planning for each patient. So it's not going to be the same for, say, patient A and patient B. It's going to be different. So it's not just one aligner. You will have a set of aligners which you keep wearing them, and you keep changing them every between 7 to 10 days. So it depends on how the teeth are moving. So depending on that, we will assess and then let them know if it is 7 days or 10 days. So suppose a patient comes in, we do the scan, we do the treatment planning. So we might get, say, 27 aligners. So each aligner, you'll be changing it between 7 to 10 days. So that is 27 number of aligners. So depending on that, that's how the teeth moves. So it's not like braces where you have a fixed bracket and then the wire and you keep changing the wires. It's not like that. Even this, the aligners are changed each week or even 10 days, and then you get the difference or the treatment plan, now actually what we plan, and the treatment result at the end of the treatment.
So would you prefer aligners over braces? Is it better or is it more advantageous?
Yeah, that's a very controversial topic actually. But yes, if you see convenience wise, aligners are much better. If you ask me why, see, aligners are removable and whereas braces are fixed. Now, when you have fixed braces, there are certain restrictions for having your diet. So you're not supposed to have hard food, sticky food, and so that makes it very difficult for some of them because you won't be able to have your favorite snack at times. But whereas with aligners, you don't have any restrictions because it's removable. So you remove the aligners, have food, and then you wash your mouth, clean the aligners, and you can keep it back. So that is the advantage of aligners. The second advantage is when you have braces, there are chances of when you bite something hard, the brackets might come out, the wires might move to one side, it start pricking your cheeks or lip, and all that issues are there. Whereas with aligners, you don't have any of that dental emergencies coming up. The only dental emergencies what I see with aligners is if you lose them, which is quite rare, but it does happen. It's quite rare, but it's very rarely you come across patients losing aligners. So that's the basic advantage what I see. And the second thing is it's convenience, and nobody's going to know you're doing your aligners or the orthodontic treatment with aligners because it's a very thin, clear plastic material which is attached to your teeth. So that's why it's much better than the braces.
So for the aligners, it's basically the patient has to always consistently wear the aligners.
Correct.
So how do you, when the patient comes to you, how do you measure the progress, whether the patient has actually consistently worn the aligners on time? Can you measure the progress?
That's a very good question. This is what most of my patients ask. I can start the aligner treatment, and if I don't wear it, you will not get the result what you are telling me in the stipulated amount of time, which is right. Now the thing is, each aligners are meant to make a certain movement of a tooth within each aligners. Now what usually happens is when you wear, suppose you wear aligner number 1 for 10 days or 7 days, and then you shift to aligner number 2. There are certain other teeth moving. The teeth which was moving previously will not move with aligner number 2. So it's not all the teeth that moves at the same time with aligners. It's particularly selected. That's what the treatment planning is about. It's certain particular teeth which moves with each aligners. Now, to assess that, like we'll go back to intraoral scanning. The scanner, actually what we use, after every 5 or 6 aligners, we do a scan again for each patient. And we have something called as treatment, like you can compare that how the teeth moves between these 5 aligners, and then we have a color code for each teeth. Now if I see more, like if I take the scan of the first and second scan, which is after 5th or 6th aligner, and we compare both, we get a color code for both. Now each color code tells us which teeth is moving in which side and if the teeth has been moved at all or not. So with that we can assess if the patient is wearing or not. So there is different color codes, like green means it's all good, the patient is very compliant, wearing the aligners 22 hours a day and changing the aligners as per what we have instructed. So that gives us a clear picture that the patient is very compliant. Now if you see purple or orange, that means the patient is not wearing them as per what we have told them, maybe lesser time. So that's when we'll have to increase the number of days for each patient. So depending on that, we can assess the patient if they're wearing the aligners or not. So there's no way they can escape that.
So that's where intraoral scanning helps.
Exactly.
Is there any side effects of using aligners or any difficulties that the patient would face?
No, it's just like braces. When you start using braces, you initially have difficulty because it's something new in your mouth, and you have pressure as the teeth move. So initial that discomfort will be there with aligners also, but much lesser than the braces. But it depends from patient to patient how their pain threshold is. So depending on that, it will be varying from patient to patient. But it won't be as much of a discomfort as braces with aligners. So I would say the first 1 week is the time when they find it very difficult, but after that it should be fine.
Is there any age that is specified, like from which age you can opt for aligners?
Aligners, usually we usually say that from the permanent dentition onwards, that's from 12. to 13 years onwards. But now with latest innovations, we can start using aligners even for patients at the age of, say, from 7 years onwards. Why 7 is because after the age of 6 you start losing your milk teeth and you have permanent teeth coming in. So when you have permanent teeth coming in, we can actually initial certain malocclusions like crowding, crossbite, all that we can get corrected with aligners, and that will reduce the chances of going in for aggressive treatment later on. Because usually when you come at the age of 12 or 13, sometimes because all the permanent teeth are in the oral cavity and the growth is almost getting over, so then we'll have to decide on removing teeth and then doing the treatment. But if you try to do certain kind of treatment before that permanent teeth comes out completely, we will be able to reduce the aggressiveness of the treatment or even reduce the amount of teeth being extracted. Even in certain patients where when they're growing up, they'll have some habits like thumb sucking or lip biting. So they have the upper teeth which moves forward and the lower teeth backward. So if this patient comes at the age of, say, 12 or 13, we might have to remove teeth. But if this patient, we can see them at the age of, say, 7 or 8, we should be able to use the growing stage or growth factor, what we call, and we can make some modifications on the bone so that the upper and lower teeth are almost placed together. So that is the latest innovation from the Invisalign company or aligners, which helps us to provide a better treatment result. So of course it's going to be a long treatment, but it will be worth it.
Doctor, approximately what is the duration of this aligner treatment?
See, it's like I said, it depends from the malocclusion what you have. Certain cases you might be able to finish it in 9 months, 6 months, but majority of the cases will take time because it's just not one set of aligners. You might finish the number of aligners what you have, then you might have to take another scan and get additional aligners to get the result what you require. So I would say it's almost the same when compared to braces, but like I said, it depends from patient to patient and what they are presenting with, what kind of problems they have, what kind of malocclusion they have. Depending on that, the treatment time varies from patient to patient.
Doctor, also after the treatment is over, once the teeth is aligned, what is the importance of using the retainers that are given to the patients?
Yes, see, retainers play as a very important factor after you finish the treatment. Most of the patients feel that once you are done with aligners or braces, that's the end of the treatment. But that is not the end of the treatment. There is a maintenance phase where you have to use your retainers. So we try to use more of the fixed retainers, which is placed behind the teeth, only in the first 6 teeth, and then we give them a removable retainer, which is same like aligners. It's what we call as A6 retainer, and they have to wear them for 6 months and then evaluate, and then see if they need to continue it. So checkups will be there even after you finish treatment with retainers, 6 months, 1 year, 2 years, so that the amount of relapse or the teeth moving is less. So retainers are a very important part of the treatment as well.
Doctor, what is one advice you would like to give our viewers regarding, those who have crowded teeth and all of that?
See, what I would suggest is, especially for children, after the age of 6, you can have a dental checkup for them and see if they have any issues coming up, like crossbite or if the teeth is being placed forward. All that issues can be handled earlier. And like all the patients, if they have crowding and proclined teeth, even for them the teeth movements can happen, but all this we need to take an X-ray and evaluate how the bone and the teeth is, and then depending on that we can make the treatment plan for them.
Thank you very much, doctor, for joining with us today once again.
Thank you.
Definitely, I hope all of the viewers found this episode helpful. We will be back next week again, same day, same time. Until then, this is Marina Francis signing off. Keep smiling, keep learning. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shop.